You, Michael, and greetings to everyone in Australia and abroad. PRIME stands for Partnership in Medical Education. Quoting the actual website, it's an international network of professional healthcare educators committed to integrating rigorous science and compassionate care for the whole person. It was started initially over 20 years ago by some very faithful Christian health professionals. And I think, as legend has it, they were visiting some countries that viewed patients merely, it seemed, as a scientific object devoid of soul. And so therefore, as the second paragraph here states, PRIME encourages and supports healthcare professionals to practice and teach sound scientific knowledge and clinical skills to consider the effects of illness on the whole person, body, mind, and spirit, and to provide care with integrity and generous compassion. Now, PRIME reaches out to people of all faiths and of no faith. Its main aim is not to proselytize as such, but through the common grace, I suppose, I would say, of witnessing with Christ's love. Barriers can be overcome where traditional evangelism may not be, I guess is one way to say it. And PRIME continues by stating that we do this through delivering teaching programs and training and resourcing healthcare educators around the world with teaching skills and materials that present evidence for the global health benefits of this approach and illustrate the practice of patient-centered healthcare. So its vision is that everyone should have access to healthcare, again, for the whole person, body, mind, and spirit, delivered with competence, compassion, respect, and integrity. In brackets, I've stated that it's based on the values modeled by Christ in whole person care. One example has been a recent series of 7 sessions, me and 2 colleagues from the UK, who were fantastic to work with, Martin and Jill, on the topic of palliative care. Being a very sober and serious topic, we nevertheless, through teamwork, partnering with our friends in PRIME Indonesia, had a very meaningful and very thoughtful and very educational 7 weeks. There was an excellent collaborative approach between us in PRIME Australia, PRIME UK, and PRIME Indonesia, which had as its faculty Maranatha Christian Hospital. And I learned as much from my colleagues there as I'm sure they learned from us. Topics included introduction to palliative care, of course, truth-telling, which I guess we take for granted in Australia and most Western countries, probably, although some may debate that. But there are a lot of cultural pressures in terms of truth-telling, patient autonomy, etc. Communication, breaking bad news, the safe use of morphine, notwithstanding accepting perhaps the different health equipment we are able to access in different countries and different parts of the world. Symptom assessment, identifying dying and loss, grief and bereavement. Now, some upcoming training series include one shortly in over 2 weeks, October the 6th and the 13th. Owen here and Michael are pivotal in that. And we're going back to core topics such as whole person medicine, values, cross-cultural considerations, Jesus as the teacher, professional values in the context of sharing and role play. And as I mentioned on the last slide, this pandemic has, in some senses, shut a lot of borders for physical travel, obviously. But interestingly, as someone said, if this pandemic happened maybe 10, maybe even 5 years ago, we may not have been as blessed with Zoom and other online learning and sharing platforms. So it's interesting that we've been able to have transnational, international teaching together. And there's another one coming up in Australia, partnering with a group of friends in East Asia that will be spread over 6 months or so. So my last slide, during and post pandemic, well, certainly during this pandemic, we're seeing collaborative approaches. As I mentioned, Australia, UK, where Prime has been invented and is spearheaded, and Indonesia, and then other countries as well. Post-pandemic, it'll be interesting to see how this does play out. I think a hybrid model would be quite good. And editorializing, I think a ministry like Prime, although for any Christian health professional interested, I think particularly for those that are semi or retired, but still have a wealth of experience to share and to give, would be quite ideal. It's not necessarily teaching the latest evidence-based medicine as such. It doesn't involve the Krebs cycle. And I think another group that particularly Prime might be very attractive to are those for personal and family reasons, perhaps part-time nurses, doctors with young children unable to travel abroad, even post-pandemic. So I'd encourage anyone to keep that in mind, for everyone to keep in mind the upcoming events. And thank you, Michael.
Richard, thank you so much.